Good morning, all of you. We already started the lecture over the neurodegenerative disorder, okay? And maybe some of you given the attention in previous class, and we discussed about the Alzheimer disease, the disease which basically affect the memory and the other cognitive processes. Now, in this lecture series, a neurodegenerative lecture series, we have another class of disease that is called as the Parkinson's disease. Have you heard about previously about this disease? You have any idea? You not heard? This Parkinson disease? Okay, so Parkinson disease is basically a disease, okay, in which our motor function impair first. Okay, we do have the normal motor functions like walking, writing, okay. Apart from that, we have the typing, okay, we can type the things, fine. We can also, you can say art, okay, we can draw the things. These all are called as the movement, fine. The movement is classified. Movement is classified. Some movements are very fine movement, okay, like the making the art is a very fine movement, okay. You know, sui dhaga karna, these are the fine arts, fine, a fine movement. Then there are the gross movements like making the movement, okay, or waving the hand, okay, lifting the leg. These are called as the gross movement, okay. ये बड़े movement है, and there are certain fine movement. So this disease primarily, okay, this disease primarily affect the motor function. आदमी को चलने, खड़ा होने, इस सब में प्रॉब्लम होना स्टार्ट हो जाएगा अगर ये डिजीज स्टार्ट होता तो. एज यू सीइंग द पिक्चर, दिस इज द old age people, okay. So this disease basically affect the old age person, okay. You know that this is a neurodegenerative, and as I said that most of the neurodegenerative disorder, they start occurring in the old age. As we are growing, this disease start attacking in our nervous system, neurodegenerative disorder. Now, coming to the first slide. These are the one quotation, and this quotation is that all our interventions, okay, all inventions, fine, all the sciences, it is only meant for giving the happiness to the humanity, giving the happiness to the humanity. The goal is to bringing the happiness to the humanity. Now, this is the lecture outline. First, we will discuss about the overview of Parkinson disease, what actually it is, what is their prevalence rate, mortality rate, okay. Then we will discuss about the neuroanatomy, because we have to touch a basic neuroanatomy first. In order to understand the pathophysiology, or you can say the pathogenesis of this disease, we have to touch at least the basic neuroanatomy in order to understand the pathogenesis. Then we will discuss about the clinical feature, okay. If this disease start occurring in a patient, then what clinical symptoms patient exhibit, manifested. Then we will discuss about the diagnosis, that what are the biomarkers, there are any availability of the diagnosis or not. We will also discuss about the treatment and management. Then we will move forward and we will discuss about the current research, and then we will conclude our today's lecture.